all the diseases which affects arteries and veins actually consider vascular health.
How are diabetes and vascular health related?
If you have diabetes, your chances of your blood vessels getting blocked.
India has become the capital of
Yes.
diabetes.
Countries like Europe and America, so they started working on this 40 years back. So diabetes very rarely get into the poor people.
Social media, it's much faster nowadays.
But now you have to say, please go out and play.
But do you think that diet,
Anything which is packed is bad. You get a blockage in the heart, you get heart attack. You get blockage in the neck vessels, you get stroke.
it's not necessary that if you look fit
Look fit, yes.
from outside, you're necessarily fit inside.
Inside. Indian diet is one of the best diets in the world.
Ghar ka khana.
Anything which is very simple is complicated.
Diabetes can actually get reversed. When we talk about health, we usually talk about the things that we can see, like our weight. But that's just the tip of the iceberg. Do we really think about what's going on behind the scenes? Like, how are our veins and arteries working? Or are they blocked? Today we have with us the director of vascular surgery at a really popular hospital and the founder of Amputation Free India. So let's debunk vascular health with Dr. Ravul Jindal. So today we're debunking vascular health
Yes.
with you. I would like to know what exactly vascular health even means.
You see, it's a very interesting question because most of the people, general public, they are
Yeah.
not aware exactly
Exactly.
what actually vascular health is.
Yeah.
So you see, our body has got all the blood vessels running around the body.
Right.
So there are arteries, there are veins, there are lymphatics. So all the diseases which affects arteries and veins and the lymphatics actually consider vascular health. And arteries carries like a very good blood from our heart and
Right.
takes it out all throughout the body. And the veins, they take the blood back to the heart.
Mhm.
So there are a lot of diseases which affects these blood vessels and which causes, in a broad term, like a cardiovascular health, is a broad term what we medically use.
Right.
So it's a diseases which affects all these blood vessels considered as a cardiovascular health.
This is a very niche, career to get into. How did you know that this was your passion?
Actually, I didn't know.
Okay.
And so while I was getting trained into PGI Chandigarh, and so there were a lot of such patients
Mhm.
who were actually not getting, suffering from these diseases. And we didn't had any such specialty, and we had very few vascular surgeons in the country. So most of the vascular surgeons at that time were trained abroad. So I thought this appears to be something very interesting.
Oh, yeah.
So I applied somewhere abroad and went to St. Mary's and then got the training into outlet there, then came back to India. So now we got a lot of vascular surgeons who are working for vascular health in our country. And 25 years back, there were very, very few people in the country. And when I started working here in Chandigarh, so there were hardly any vascular surgeons in all 4 states.
Which is really surprising because you would think that, because your whole body is made of blood
Yeah.
vessels and arteries.
Absolutely.
So why would you not focus on something that...
Absolutely. It's really crazy. And you'll be very surprised to know that still in 2024 and still in the medical training programs,
people are clueless.
people are actually, they are still not up to the mark they should be. And most of the developed world, so even every district hospital, every smaller district hospital will have a vascular unit out there. So if we look into, let's say in India, we got around 450, I think 500 medical colleges.
Right.
I don't think more than 20 colleges will have a vascular unit.
But why is that? Why
I
is
think
the
it's the-
awareness about vascular health?
It is just because there is a lot of overlap. Because changing the policies from the baseline, from the government, from starting, it takes a really lot of, somebody has to push the system. It's getting improved, definitely. The government is doing quite a lot. There are a lot of training programs now There are, but vascular health is also partially taken by. There are a lot of cardiologists who are taking care of that, but there are still very few people who are taking care of the peripheral vascular health.
Right.
There are very few people who are taking care of the neurovascular health, and so I think it's improving. And but we are still, if you look into the Western world and if you compare it, we are still around 10 to 15 years behind. And I feel personally that every medical college or every medical university or hospital, government hospital, should have a vascular unit. It's like a necessity, a vascular unit in the hospital. Definitely.
I agree.
Right.
Because mostly you just hear about cardiovascular.
Yes.
But there are so many more arteries in your
Body.
than just
Absolutely.
near your heart.
This is a very interesting question. Yeah. You see, if you look into the heart, so that affects less than 5% of the blood vessels. They are very important. They are the most important.
They are, of course, the most
heart
important.
is the most important thing.
Right.
But they are less than 5%. So 95% of the blood vessels of the whole body, somebody has to take care of.
Right.
And they are taken care by like intervention radiologists, cardiologists, cardiac surgeons, and vascular surgeons. So there are 4 specialties who overlap into all these branches. But when you come to the neurointerventionalists, so they take care like of the only in the brain part. So
they don't get into vascular.
Normally into peripheries, they don't get into it. But intervention radiologists, plain intervention radiologists, so they can take care of quite a lot of blood vessels, but then they don't do open surgery. So they do only endo. So then comes the cardiac surgeons. So most of the cardiac surgeons are not trained into peripheral vascular surgeries. So then come the cardiologists. So they cannot do open surgeries. So that's why a vascular surgeon is a very, very important specialty, because they take care of all the blood vessels of the body.
Right.
So they manage them medically, surgically, and endo.
It almost feels like what you're saying is, okay, there is a house and there's a whole piping system in the whole house.
It works like this.
And
absolutely.
Then people are calling an electrician to clean the pipes. People are calling some other person, but they'll not call the plumber to
Yes,
clean the
absolutely. It actually does. And we have been trying quite a lot from last 25 years and to create an awareness about this to the common people. And actually, common people is of course required, but even to the specialists. So you will laugh at it. When I opened the first vascular unit here in Chennai, so people didn't actually even know when I went to the periphery that periphery, like, do you do an angiography for the legs also? Like, these were the questions. Really? When we used to treat diabetic foot, like where the blood vessels block in the legs and you get gangrene and amputations, people used to say, you cannot save these legs. It's impossible. And it was like 95% success rate, So it was a difficult situation. But now a lot of people are aware. And with the internet and with the marketing and the Google and the chat GPT coming in, more and more people are good into it.
That's good. I mean, talking about diabetes, how are diabetes and vascular health related?
You see, if you look into grossly, all blood vessels get blocked by mainly 4 to 5 things. Okay. One is we cannot change, is the age.
Yeah.
So as we grow old, our vessels will block. Second is the blood pressure. Third is the diabetes. And fourth is smoking. And the fifth is your eating habits. Like if you eat high fat diet, so your blood vessel get blocked. So these are the main 5 causes which will cause you blockage of the blood vessels. So if you have diabetes, your chances of your blood vessels getting blocked becomes much higher. And as you know, diabetes is like increased blood sugar levels.
Right. Yeah. Because diabetes is on such a rise, especially in India.
Yes.
India's become the capital of diabetes.
Yes, absolutely. You are absolutely right. Good. Very nice. Very nice. You see, we got one of the largest number of diabetics in the world.
Right.
And if we divide the world into 3 categories, the developed world, developing world like us, and then there comes countries like Africa. So in countries like Europe and America, so they started working on this 40 years back. So they have slowed down the prevalence with education. So if you see, when you go to Europe, You see,
Right.
everybody is running,
That's
and they're
true.
so conscious about the diet, what they're eating. And India is, the younger generation is slightly more careful, but
Are we more careful?
slightly.
I feel
not
like with the generation
slightly.
of Zomato.
That's why I'm saying slightly more careful. But at the same time, they are getting influenced with the Western world.
Correct.
Because both things are working at the same time. But you still see now the parks are full. People are running, walking, jogging.
That's
So
true.
they are doing more.
Yeah.
But at the same time, if you look into the prevalence in our country, it's increasing. It was around 7%, and now it's around 9%. And if you look at particularly in Chandigarh, the prevalence is very high. It's 13 to 14%. So we have got one of the largest number of diabetics in terms of population based in the country. And you know why it happens?
Why?
Because diabetes is directly relation to high prosperity. So if you're rich, you got more chances of becoming diabetics. So diabetes very rarely, get into the poor people.
And why is that?
Of course, we eat bad. We don't exercise much because we got more luxury. So we don't do manual labor. So we do, most of the people who are rich, they will be doing an office-based work. They'll not be walking around. So they will be eating high-fat diet, more alcohol consumption, more access to smoking. So
Yeah, more sedentary lifestyle.
More sedentary
For
lifestyle.
sure.
definitely.
But what is the difference between diabetes in the rural areas and the urban areas? Since you must be dealing with a lot of people.
Yes. People in the urban area, they get more diabetes,
Mhm.
but they're more aware about it. So they get it more controlled. So they take much more medicine. So that's why the number of complications of diabetes, they're much lesser. As compared to the rural area, so they get less diabetes,
Right.
but
less awareness.
less awareness. So they get more complications. So they take, like, I will take a tablet of sugar when I know that my sugar levels will be high.
Not like a regular
thing. So because it's a lack of education. So there are both ways.
They both weigh each other down.
Down, yes, in a way. So that's why I think we need to really look into this, and we need to have a huge number of diabetic prevention programs in our country if we want to actually, because the effects of the preventions comes in 20 to 30 years. So if we start doing the things now, then the effects will come in 20, 30 years.
But do you think with social media, it's much faster nowadays to
It's
spread
much
awareness?
faster, but changing an habit of a person, what he eats, is very difficult. So what we have been working on is, so we thought 5 years back, so the best way to change the habit of a person is when the person is young in the school. So we are developing a school modulation program, and so that we can start training the kids in the school and change the way they habit. Like, there are only two things to change: what you eat and exercise. So if we do this, that you need to exercise every day in your program, and you need to eat healthy, you know what to eat, you will reverse the ratio. But now with the mobile, social media, iPads, everything coming in, we did a study 6 years back in all the schools in Chandigarh. And we found that the obesity rate was 45% in the school. It's like huge. In our time, it was like 3 to 5%. So the obesity rate is increased. So obesity in the kids is directly proportional to the diabetes in the younger age.
Of course, I mean, that is no rocket science because, kids are always on their phones, their iPads. And you never see kids in
Playing.
parks nowadays.
Yes, you see, that's the thing.
Exactly. So do you think that's making a difference?
Of course. So that's making the difference, We never used to come home.
Yeah.
Our mothers used to scream, "Come home, why are you playing on the street so much?" But now you have to say, "Please go out and play."
Yeah.
So it's totally opposite, and that's why the obesity rate is much higher. And we also found that the rural and urban school does not have a different data. We thought that the urban kids who are
would
rich,
be
more obesity as compared to the rural, government schools and other schools. And we found that the obesity rate is actually among the kids is similar. And so means because the accessibility to the food, even for the people who are not very rich, is similar as compared to the people who are rich.
But do you think that diet in general, like the food quality, is decreasing?
Of course, you see, there are certain things which you cannot help. Like, let's say, who is growing the food?
Right.
How much pesticide that guy is putting
Exactly.
in? Is he giving the things properly or not? But one thing is definitely there in our country, which we have. We got a huge amount of vegetable markets, fresh fruit,
Yeah. Farmers
vegetable
markets. Yeah.
where we can at least get the fresh food. We can wash them properly. I know, the chemicals going inside the food and the fruits we cannot change, but that's the drawback of everything. Second is, we should not eat packed food at all. Anything which is packed is bad. So it's like a very common sense, but people don't use this common sense.
Because preservatives.
Preservatives, simple. So every preservative has got carcinogenic agents, though they are in small amount. Carcinogen means like they can cause cancer.
Yeah, of course. Yeah.
And second is, they are very high in salt. So any food you need to preserve, you need to add very high quantity of salt. So high salt, high
sugar.
preservatives, high sugar. So anything packed, like as a principle, I try to do it. So anything which is packed, I don't try to eat. So we can fresh anything which is made, like cold drinks, Coke, Fanta, any all cold drinks.
Sodas are killers anyway.
Killer, anyways, high content sugars, preservatives. And you should try to drink, which we had a traditional, so nice, Nebu Pani, lassi. So we have, green tea, which is there, normal tea, Indian tea, which is there, you can have, So it's all about what you eat, what you want to put inside your body.
Yeah, you are what you eat.
Yes,
Right.
absolutely.
Yeah, and do you think that diabetes can actually get reversed?
And yes, in an early stage. Not in every patient, but because diabetes is not only related to your eating habits and obesity, it's also related to your genes. So if your genes are very bad and very strong, and then you get a diabetes, then you may not be able to reverse it. But if you proper do an exercise and control your diet and food, at least you will be on a smaller doses of medication, very small dose of medications. And there are a lot of people who are, once they get a diabetes, they really get very strict about it. And they, with a very extensive exercise, they lose weight, control the diet. They, what we call as diet control diabetes. So they're not on medicines, but with the control of everything, they're able to control their sugars. Weight is the most important thing.
Right.
Yeah. So the moment you get more obese, your chances of diabetes becomes more.
Yeah, that obviously makes sense.
Yeah.
And what are some other vascular diseases that you've seen on a rise in the past few years?
What we see, one is, of course, the diabetes-related gangrene, which is very important, because when the diabetes will go up, diabetes-related blockage of the blood vessels will happen. Diabetic-related neuropathy, like you don't feel anything in the symptoms, and the gangrenes in the foot will happen.
Yeah, a lot of people start getting numbness in their feet.
So that is what we call diabetic neuropathy.
Right.
So it is on the rise. Second, what we see is varicose veins.
Yes.
And it's not on the rise. I think it's more people are aware now. People never used to bother about it. And so varicose veins is like a dilated veins in your legs. So people are much more aware about it, and people come to us with lots of complications. People are living longer. So, our life expectancy has increased a lot. So that's also to do with varicose veins, because it increases with age. So you see much more varicose veins. These are basically two diseases, and then we see patients with stroke. And because stroke happens because of your blockage of the arteries in the neck. So same vessels, like you get a blockage in the heart, you get heart attack.
Right.
You get blockage in the neck vessels, you get stroke. So, so we getting more stroke patients.
Is there any way you can prevent these strokes? Like, are there any early symptoms? Because when you get a stroke, it's a stroke in your...
Yeah.
Obviously, that's very extreme.
Very extreme, yes.
But are there any early symptoms of strokes?
Everything, all these things can be prevented by the same prevention programs. Like how to improve our vascular health. So that's a question. And how we can improve our vascular health is because we know what causes vascular problems. So if we look into it, like not smoke, don't drink, eat healthy vegetables and fruits, Try to be vegetarian. Very important, because all meat diet based diets are associated with fat and lipids. You can eat someday, but not as a routine. Then comes the high lipid diet, fried and anything you want to eat. It should be preserved foods. Then exercise every day. So if you do all these preventive techniques, so you improve your vascular health.
And if you do all of these things, but it's still there in your genes.
That's very rare. That will affect not more than 1% even. So this is like, very
So because
rare.
you're not giving the right environment for the disease to grow.
Yes.
Right?
Because that is there. Because there are some genetic factors. If you control them, like if you control with because there are genetic things which are very, very rare, which are very severe. But some genetic things get influenced with the environmental factors. So if you can only control the environmental factors. If you control the environmental factors, some people will not get, even the genetic ones will not get vascular problems. So that's very important. Yeah.
That's interesting. And what were some other vascular diseases that?
We see, besides this, we see a lot of patients with kidney failure.
And that has something to do with vascular?
Of course. Absolutely. So diabetes blocks all the blood vessels of the kidneys and you get kidney failure. So everything which is there happens in our body. Most of the disease happens because of vascular issues.
And still there's such less awareness.
Of course. So kidney failure. So we have got one of the largest number of kidney failure patients in the world. India, of course. India is at the top. And we don't have a very robust kidney transplant programs because we don't live donation kidneys. Is there, but cadaveric donation is very low. So people don't donate kidneys because of afterbirth mythology we have, as a Hindu mythology. So that's why kidney failure patients require a dialysis access. So we do a lot of dialysis because they require a dialysis to live. So we provide them a huge amount of dialysis access programs. Then we see a lot of trauma patients, accident patients.
Okay, accidents.
So any accident, one of the major cause, like one of the cause you die in an accident is because of vascular injury. So if you bleed, you will die. Simple, very common things.
Obviously.
So we get a trauma all over the body, neck, arms, chest, abdomen, legs. So blood vessels, they break. So we repair them, control the bleeding, tries to save the patients. These are sort of very common things. Then we also deal with AV malformations. It's called an arteriovenous malformations. It's a congenital disease. So you are born with from birth. So your arteries and veins are not connected together in a right way.
Okay.
So there are a lot of vascular disease. Then there are very rare things which we see.
And you're also into amputations, right?
Yes. Amputations is because once your leg patient comes very late and because of the diabetes again, your blood vessel block and you get gangrene and you don't come on time to the hospital, then we have to amputate. Amputation is a layman term, like you cut the dead limb.
Right.
So it's a very bad thing. So sometimes we have to do that to save the life of the patient.
And how do these vascular diseases actually get detected? What are the tests that you have to do for them?
You see, most of the patients, when you get a vascular disease, so these patients, they come with the symptoms of the area which is affected. So let's say you get blockage in the neck. So you get to the hospital with like stroke or TIA. You get blockage in the arms, you'll get a pain in the limbs and everywhere.
Yeah.
You get blockage in the kidney arteries or gut arteries, you'll get a pain in the tummy. You get blockage in the legs here, you get a difficulty in walking, and you may get a gangrene. Like gangrene is a dead limb, a small dead toe or something like that. So depending on what area is affected in the body, so then first we have to examine. Then we get an ultrasound done. The ultrasound is a very simple investigation, which is available everywhere in our country, which is very good. So we can get an ultrasound done. And then we do a specialized test, like a CT scan or MRI scans, depending upon the area what we want to see. It's a very, very specialized test. So we need to decide, did the patient requires this or not? You know?
So, you know how we do general body tests every 6 months or
Yeah,
a
yeah, yeah.
year? Are there any general tests that can be done to maybe see, okay, there's blockage in this part of this
As
body?
such, we don't need to do that. Okay. And like if you are young and fit and you don't have a symptoms, you don't need to do a routine blood test as such. But once you pass 30 years, and then maybe once a year, you should do a simple test like lipid profile. Because lipids is one of the most important thing which will get, dearranged in the beginning. So if your lipid profile is bad and your weight is higher, it all depends on, do you have the risk factors? So risk factors means, so you do
High
the blood
weight.
test if you do weight high, if you
Diabetes.
smoke, if you have diabetes, if you drink alcohol every day, and all these things if you have, then you have to get the blood test done regularly. But if you are like fit and hearty and healthy and you are slim and trim, and then you don't need to do the blood test as a routine every day. But maybe like once or 2 years you get a lipid profile done and a general body simple blood test, and then see. And but when you start getting old, like 40s and 50s, and because the disease comes with the age,
Right.
then you start going into specialist tests. Then maybe in 1 and 2 years you get an ECG, an echo, or a treadmill test to look into your heart, because heart is one of the first organs
To get affected.
which will, because when you walk you'll get chest pain. So then show it to the cardiologist, see your health is okay or not.
But don't you think nowadays we are hearing so much about young deaths because of heart attacks? And a lot of those deaths are actually happening in gyms.
Yes.
So, what is the reason for that then?
There could be various reasons. It happens because of performance. People exert themselves too much sometimes.
Oh,
Because if you do exertion beyond a particular level,
so your heart
that-
stops pumping.
heart can get problems. Second is unhealthy. I hear from a lot of my friends what they do. They drink 5 packs in the night, eat the most unhealthy food you can think of, and then they will go 2 hours gym in the morning.
Yeah.
And they say this is all equivalent. But this is not equivalent. Sorry. Because what you are doing is you are controlling your weight by this, but that weight is not the only thing. So that's why you see people, oh, he was so fit guy, or how can he die? Because we need to go into the depth of the history. We don't know the whole medical history. Those guys, they smoke also 10 cigarettes in the night. So smoking, unhealthy diet in the night, and then doing the gym in the morning does not prevent your heart attack.
So, it's not necessary that if you look fit
Look fit, yes.
from outside, you're necessarily fit inside.
Inside, yes. So what we call it as metabolic fit.
Mm.
So metabolic fitness is more important than your look fit, which
Right.
is there. This is two important things to understand.
Right.
And third is a congenital disease, like you get genetically what we were talking about.
Right.
So you could have arrhythmias. The person may not know, he was just doing the gym and he died. It's an incidental thing. He could have died in the park, he could have died sitting at home. There are a lot of other causes also besides heart attack. Heart attack can happen for various other reasons also. So like you get rhythm disturbances, you get higher multiple rhythm issues, and a lot of other things. Let's not get into technical parts. So it's not only metabolic. So we need to, once the person dies like this, so we need to go for postmortems and look into it, why it happened and all. But normally in such deaths, postmortems are not happened.
Why?
Because it's not medical legal. It's the wish of the family if they want postmortem or not. So it's a lot of, so we don't know. But definitely our health, vascular health, one person has to look into it.
And do you think our Indian diet caters to a balanced diet, or are there any things that need to be prevented from our own diet?
I feel Indian diet is one of the best diets in the world. This is my really my thinking it. But Indian diet does not include bhaturas, samosas, and fried foods. I'm not talking about that. I'm talking normal Indian diet.
घर का खाना.
घर का खाना जिसको हम बोलते हैं normal way. पर कई लोगों का घर का खाना का भी definition बहुत फर्क है.
हाँ.
So what I'm saying is like normal food is good, but anything fried, of course not. Because Indian diet, mostly Indian diets, is vegetarian,
Yeah.
which is good. Second is it's mainly based on plant-based diets, which is nice because it's healthier. And mostly it's cooked well, so it's not raw, which is good. We always used to eat fruits and salads with it,
Right.
so which was very nice, which is good for
Fiber.
it. We always used to have like bit of milk into it, proteins into it. So this was a very good Indian diet which we want, legumes and cereals and everything. Not the diet which is like based on meat based,
Yeah.
raw meat based, which may not be the best diet in
Right.
the world.
But a lot of people argue that if you don't eat meat, you're not going to have enough protein in your body, and then your muscles are going to get weak.
You see, muscles gets strengthened by exercise, and your normal vegetarian diet actually will have enough proteins. Most of the bodybuilders, the best bodybuilders in the whole world, they're all vegetarian.
Yeah.
So it's not about the non-veg.
And they're even moving away from dairy now. What do you
Yeah,
have to
yeah.
say about that?
Yeah, there is a lot of move about it.
Mm-hmm.
There are a lot of new people. People are saying that, plant-based dairy, are there now. In Australia, I went to a shop. I was amazed. 20 different types of plant-based milk.
Wow.
Like every seed, they have taken the milk out.
Which one was your favorite? Did you
No,
try all of
I
them?
tried. Almond was very nice.
Yeah.
So, but
And almond milk is so easy to make
I
at
know.
home, actually.
Yes.
Yeah.
But it's very high in calorie. Very high.
Almond milk.
Of course, it will be. So,
Because it's
but
just made out of almonds.
yes. So almond is very rich in calories.
So
And-
is it not good to consume almond milk?
No, you can consume, but like if you consume 100 ml every day, like you will be
100 ml is barely anything though.
no, yes, but it's very high. It's very good in minerals and vitamins and everything.
Yeah.
But it's also rich in very calories. So you need to look into how much calories this contains. So
Even
because-
if it is homemade.
yeah, but almonds are almonds.
Yeah, but like I usually eat like 10-15 almonds anyway.
Yeah, but you are fit, na?
I only look fit. Maybe inside I'm not.
I don't know. So, but yes, but anything, you need to look into your total calorie count per day.
Okay.
So, normal adult human being should not consume more than 1800 to 2000 calories. So that's
And how should you balance it out? What should be, because protein has become such a big thing. They're like protein.
I know. So people think that there are three important things. One, people think the fat is bad for our health.
Yeah.
People must understand fat is very important for us.
It is.
So because all the cells, all the things, they move with the fat. So we need fat, small amount of fat. Then we also need carbohydrates. So around 50% of our diet should be carbohydrates. People don't eat carbohydrates at all. And that's why I feel, one should not stop anything. You should have a mix of everything. And around 25 to 30% should be proteins. And around 15 to 20% should be fat.
Right.
Depending upon how much you gym or exercise, everything, you have to balance accordingly. So I feel that you need to look into all this. And then there should be a component from where you can get fresh vitamins and minerals. Like nuts, fruits, vegetables, fresh, without cooked vegetables, like salad.
Right.
And
ancestrally, ghee has been a very big part of our diet, and it's considered to be a good fat. Do you agree?
Slightly disagree.
Okay.
Sorry.
No,
but,
I mean,
you're saying,
I never said anything.
No. So, you see, this is a good question. Because let's talk medically.
Right.
Ghee, any fat, it's a very good rule of thumb, I'll tell you. Any fat which is solid at room temperature. So like butter, ghee, margarine, like any such fats which are there solid at room temperature. So they have an hydrogen atom added to it.
Okay.
So small quantity, they are okay.
What about people who cook food in coconut oil?
Yes. Okay. So then I'm coming to that. So these fats are not the best fat for our body because they contain less good cholesterol, HDLs, and more of LDLs, which are bad
LDLs.
cholesterols. Then comes to the vegetable oils. All vegetable oils, they are liquid at room temperature. You take any vegetable oils, safflower, flower oils, anything you take, sunflower oils, anything. So all oils which are liquid at room temperature, so they are good for our health.
Really?
And everything should be cooked in the fats which are liquid at room temperature. Now, third thing is all fats which we are talking about, the liquid ones, so they have some component better and some components bad. So that's why we should never stick to one oil. We should keep on changing the oils in our houses. So that 1 month this oil, another month that oil, because some has got more omega-3 fatty acids, some has got more omega-6 fatty acids, something like that. So one should keep on changing the oils.
Which one is the best oil?
Olive.
Olive.
Definitely. So in terms of medical and in terms of research, so that oil has got that is called as the monounsaturated fat acids. It is the largest. And this has got the largest amount of HDLs, better cholesterols, and the lowest amount of LDLs. So, but everybody cannot afford olive oils. So that's another very important point. So it's not about that everybody needs to be only olive oil. So people can use mixture of vegetable oils and mixture of olive oils. So that's I think the best thing. So that's why if you look into the countries which has got the highest life expectancy, like people who live around the Mediterranean Sea. So the only thing which they found the difference is they eat a lot of salad and olives because they grow there. And so they put in, they don't fry, they don't cook, in oil.
That's what I was
So they put in the olive oil on all the top of the salads everywhere, all the breads in the oil.
That's exactly what I was going to say. When you heat an oil, doesn't the composition of the oil get changed?
Of course.
So isn't it harmful when you cook something in the oil?
So that's why I told you, everything fried should not be done.
So and what about mustard oil? Because
mustard oil is a vegetable oil. So it's a liquid at room temperature. You can do it.
And when you compare olive to mustard?
Of course. Olive is the best.
Olive is the best.
Of course.
But not cooked. Not
cooking. See, when we do Indian cooking, let's say, you put in a spoon of olive oil. So just to have the vegetables, they don't stick to the pan.
Correct.
They put have a taste. But it doesn't give you, you're not adding the oil. Yeah, frying feelings. Frying. It's okay. And you can actually do a oilless cooking if you want. So absolutely. Now you get a non-sticking pan, so you can have a absolutely oilless cooking. So I cook whenever I make vegetable, I cook absolutely oilless, totally. I don't add oil at all.
That's interesting.
Yeah.
That is very interesting. Let's talk about your amputation free India movement.
Yes, so that's very close to my heart. So we started 15 years back. And so we made our society as a Vascular Society for Limb Salvage. And slowly we started this program that because there were a lot of diabetes, a lot of people with diabetes coming to us. They were coming very late to us. So we actually could not save the limbs. And we actually had to amputate all the limbs. So we thought, let's start with education. So then we started a program of educating people, educating public lectures, educating doctors, educate the specialists, the super specialists, like the cardiologist, intervention radiologist, and totally super specialists, that these limbs can be saved. And so we have been running this program for many years now. And our Vascular Society of India, which is a main national body of the vascular surgeons, and we run this campaign in a very big way. And with 400 vascular surgeons all across the country. And this year we had around more than 35,000 people, public people, were involved in more than 30 cities across the country. So it was a very, very big campaign we have been running in every areas. So I think a lot of things have changed. We get now a lot of patients at a very early stage in our clinics, still not where we want, and but still better than before. But I think a lot needs to be done into this field.
What is an early stage for diabetic people?
Very simple. Every diabetic patient, they must check their feet daily.
And how do they check that?
Simple, by visual. Seeing. So just see your foot every day. If you found any wound on your foot, you must go to the hospital doctor immediately and local doctor, wherever they want. And if the wound does not heal within 5 days or 7 days, they must report to the vascular surgeons immediately, period. Because all the wounds in the foot, they must show signs of healing in 5 to 7 days with antibiotics. And if the wound is not healing, that means there is some problem. And they must be evaluated by the vascular surgeons like immediately. And if they come at that stage with a wound, small wound, 5 to 7 days old, nearly more than 98% of the limbs can be salvaged. It's so simple, actually. It is very simple. But how to get this message to every diabetic person in the country, that's what we are doing.
And what about the numbness in the feet?
You see, numbness happens because of prolonged diabetes. And numbness, there is not much treatment in the world. So once you get numbness, you are stuck. So the only thing is prevention. So everything is prevention. So once you are bad, then it's late.
So that cannot be reversed?
No. So that cannot be reversed. So that can be controlled so that it does not progress. So the only thing you can do in diabetes is prevention. So prevention happens by controlling of sugar. So your sugar level should be very strictly controlled, so that the chances of you getting a numbness becomes very low. So it's all prevention. So our Amputation Free India program, which is there, it's all about teaching. So we have launched the books, we have got the websites. It's all about education. So it's all about prevention.
But I think then you also have to be willing to soak that knowledge, right?
Yes.
Like if a person doesn't know what is going on with them, they will not look for that information. So how do they know? Like how should someone know at a very early stage that this is what I need to prevent?
This is all education.
But you know what I mean?
I know.
So through our conversation, I would like people to know that this is something that you should do. At least reach out.
You see why we are discussing today?
Yeah.
It's the same thing.
Exactly.
Why we do such TV programs and preventions. We don't have money. Otherwise, I would have run an ad on every TV channels in the country, and that prevent. But it costs a lot of money. So I feel like the government should put in the steps forward and run a free health ads. How to prevent this, how to prevent that, how to prevent this,
Yeah, if only people were actually so philanthropic.
Yes.
And cared about other people, then they would do things. And in India, I think every 10 seconds now we're detecting that one person gets diabetes.
Yes. It's not actually like it's the whole world data.
Right.
So every 10 seconds one person gets diabetes. And it's a huge number. It's a huge number. Huge. So that's why the biggest killer in world today is diabetes. And the number one killer in the world is cardiovascular death. So that's what we are discussing today. And people are not aware about it. So people know that they die because of heart attack.
Yeah.
Everybody knows.
That
even the rickshawala will know.
The end. Yeah.
Okay. But people don't know in the gross terms that it's not only heart attack. It's a cardiovascular death. And cardiovascular death means blood vessels of your whole body. And you die. So that's the number one cause. And the stroke comes like the third most common cause of death. So in most common cause of all this is diabetes. So the root cause is diabetes, and that affects all the blood vessels. And diabetes can be controlled with healthy heart and healthy food and healthy lifestyle.
So it's all
like a vicious cycle. Yeah, it's all related. It's all related.
And how can you prevent cardiovascular diseases though?
Same, healthy lifestyle, food. It's all linked. It's very simple, but that's the problem. Anything which is very simple is complicated.
And nowadays supplements are so big in the market, right? A lot of people are taking supplements for cleaning their systems, for vitamins,
Yeah.
for minerals. Are there any supplements out there in the market that can help the vascular diseases?
Huge.
Okay.
It's a multi-billion industry. Okay.
Is
I'll-
it just for money or does it actually help? Is the real question.
I'll tell you my viewpoint.
Yeah,
Okay.
that's what I want.
So I'm not talking about, let's not debate about it. It's a very big topic. I'll tell you my viewpoint. My viewpoint is very simple. So anything synthetic is bad for your health. Okay. First, in one line.
Medicines, but
Of course, medicines are bad for your health. You have to only take when if you are diseased. So I write very little medicines to the patients. So this is very simple. So I feel any supplement which is synthetic is 100% bad. It cannot be good because anything you want, you can get with a natural food. Anything. Of course. First. So second is I feel I'm anti-supplement guy. So I feel the supplements and anything should be taken only if you have some disease or you're suffering from something, you are having a deficiency, you take it for a short while and stop.
Right.
So, okay. Anything people claim that they are making it through a natural route, please, I request them to take a photograph of the label at the back, enlarge it, and put each constituent into the ChatGPT or Google and read about it. My feeling is you will stop taking it
immediately.
So this is my thinking. Okay. So I'm like, why will you eat preserved neem or Karela's, tablets? Why can't you eat fresh?
Because they claim that, this has the power of
I know.
20
Claim.
Karelas.
So, okay. So I need to see those studies done.
Right. That's the thing, is
So there are
that
no studies.
most of these things,
They don't have studies.
they don't have enough
They
research.
cannot have, because they cannot do it. How will you have, let's talk about any compound.
Right.
XYZ, X compound. Natural nutrient supplement. Synthetic, though I'm out. Okay. Natural nutrient supplement.
But for everyone's knowledge, what are you defining as synthetic supplement?
Anything which is made from synthetic compounds. So like all multivitamins which you see in the market.
Like D3.
I don't want to label the labels.
B12 and
anything.
all these.
They're all synthetic.
Okay.
Sorry. They're all synthetic.
No.
Yeah.
Fine. Sorry to me. I'm on the same
Fine.
page.
So they're all synthetic. So okay. So anything natural, if you take a supplement, do you say that this supplement will do this, whatever? You need to have more than 10 to 20,000 people, put it into two groups, follow them after 10 to 15 to 20 years to do a study to show, and with the same controlled factors, same diet, same controlled, same environmental, same genes. How is it possible? It's not practically possible only.
Correct.
So that's why I feel medical science is very complicated. I say always, when I say very openly, this is my viewpoint.
Right.
I feel the medical science is very complicated and we should be very careful and we should use a common sense. And common sense is very important to prevail when you make a decision to eat anything and want to put into your body.
Correct. So we spoke about synthetic supplements, but now what about the ones that claim to be natural? Because a lot of people are now claiming, Sheila Jeet is really good for men's health and ashwagandha. In fact, you're seeing such a big cycle, such a big movement in the West in terms of like ashwagandha.
I know.
And
so all that will be coming to India now. So
it went from India only.
No. I know. These are all natural compounds which we used to do it in India. But they all went abroad.
Right.
So now they are all coming back to India.
Okay.
In a packaged form into 20 times the cost.
Correct.
Because people have surplus money. So people want to look young. You see, everybody wants to look young and fit and everything. Of course, it's a normal thing. Okay. But at the same time, people don't want to put in an effort to do this.
People want to take shortcuts.
And the shortcuts, what people want is, this should be a pill, just take it, pop in, and I should be fit for everything. So that is not the solution. This is my thinking.
So you don't support the natural supplements also. You think that they're not as...
Natural supplements are stored and packed
Right.
in a box.
Right.
So which I don't support unless you are sick or you have some disease.
Yeah,
Okay.
of course.
I feel if you want to have natural supplements, please have a bowl of fresh fruits and vegetables in the morning and put some nuts into it.
Right.
And that should have actually every possible supplement what you want to have.
Mm-hmm.
Okay, I'm not talking about the disease. Like if you have an iron deficiency, you want to
Yeah,
take
of
an
course.
iron.
Then
That's
you
a
have to
different
take
story.
iron.
I'm talking normal, natural human beings who are walking around.
So the baseline is that if you don't have any disease and if you don't have any deficiency, you technically should not be taking supplements, and you should...
This is my viewpoint.
And I totally support it.
You know,
And you should basically just follow a natural diet and try to stick to a natural diet as much
this
as
is
possible.
I feel very strongly about it.
Right.
Very strongly.
You know how like they say, oh, neem can detox your body.
Neem
or...
is comes into vegetables.
Okay, so that's what I'm asking you. Like, you think there are any ingredients that people
There
can
are
have?
not particular ingredients which will improve your vascular health.
Okay.
Yes, they're not like one particular ingredient which will just say, oh, it will improve your vascular health. It's a combination.
Mm-hmm.
And because the same comes to the point, because we cannot work on like neem ke patte kisi ko khila ke, how can you do the study for 20 years to make sure that this disease does not happen to you?
Right.
It's difficult to do that studies. There are some situations like, I'll give you an example, very funny example, you will like this. There was some study published around 15-20 years back that if you take red wine, it improves your cardiovascular health.
Yeah, that's something
Okay.
that people
My goodness,
follow.
wherever we go to the parties, tell everybody, talk. So have red wine, so because it improves your health and all. I said, please, you do. And so we have shifted from the whiskey now to red wine now, because it has been shown that red wine improves your health. Please, all alcohol are bad for your health. But if you want to drink, it's okay. You enjoy. You should know. And you can drink alcohol for enjoyment, entertainment, fine.
But what is a safe level of alcohol that can be taken?
So that's another question. But I'm telling you this about this study. If you go in detail about this study, it shows there was an absolutely mild marginal improvement in the health. And after that, no study has been done. So now the latest guidelines which has been published is that all alcohols in any form taken are bad for your health. So, red wine may be slightly better than the other ones, but
it's a lesser evil.
That's a damage. That's the thing. Safest levels are, there is a British guidelines for drinks which has been published. Absolutely. They say it's better if you don't drink, but yes, if you want to drink. So then there are guidelines. So it basically comes into is that you can have 10 to 14 shots of spirit a week.
That's a lot, no?
Yes, but Britain is UK is very big. So 10 to 14 shots a week is like, if you drink this much, the chances of your getting complications are less. And so that's the theory. And that includes 6 glasses of wine per week, 14 shots. Yeah,
that's like one every day.
Yes, so that's why the guidelines are made. But nobody knows the long-term results about this, So they made the guidelines. So this is the
But what if they made the guidelines based on?
They made the guidelines on the basis of seeing the number of patients with these people who have been coming to the hospital and emergencies and all. So if the people are drinking this much, the chances that you will fall into an emergency or with a liver failure or kidney and cancer and everything will be less. But alcohol is also associated with multiple cancers in our body. So we have to be a bit careful. So I feel you should drink alcohol as much as you require, and you should know that how much to drink.
But does anyone require alcohol?
As such, no. But yes, people want to enjoy. So then, yes, So you should be knowing what you're doing. It's a very personal decision.
And what about smoking?
Smoking is absolutely no. Like, NO means NO. Like everybody. It has got the largest amount of side effects and any man-made thing can have.
And it's still marketed.
Of course, it's a lot of money for the government. So actually talking, if you look into the country profile, so every country, the best thing is to stop smoking. Like they should ban, rather than giving an ad into the PVR that not
Correct.
smoke, is it better that they stop the manufacturing in the country? What will
Right.
happen?
People will get better. People
People
will
will
fall
get better, but what people will do is then they will start making tobacco at home. Of course. And then will be black marketed. And then, the things will start. In India, a very interesting story. In India, e-cigarettes are banned.
Mhm.
Why?
I don't know why.
E-cigarettes are better. And the constitution says the e-cigarettes are worse than the normal cigarettes.
Because then again, I mean, it hasn't been so long that e-cigarettes have been around. So there's
So-
not enough research that has been done.
It's
on it.
20 years now. So, and there are a lot of data published. And it works on the basis of what are the constituents in the cigarettes, in the smoke, what
Mhm.
are there and everything. And a lot of publications are there which shows that e-cigarettes are better than the normal cigarettes.
Do you think e-cigarettes are better than normal cigarettes?
Yeah, it's not my thinking. It's a proven, it's like literature. Okay. But of course, all cigarettes are bad. What I'm saying is e-cigarettes are better
Less
than
evil.
the less evil. Okay. But still are banned in India. Why? So I don't want to say here it in public, but I know the answer, but
It's fine. Whatever you're comfortable with,
yeah.
honestly. Generally.
So there are a lot, one has to work on the facts which are there. What are the data which is published?
What is the one vascular disease that you've seen very closely and you think has gone bad to worse in India?
I think diabetes related vascular health. It is gone, of course. It is increasing because the diabetes is increasing. It will block more blood vessels. It causes kidney failure, and kidney failure itself causes very bad vascular health. Very bad vascular blockage. So if you get a kidney failure, your arteries will block like anything. You can't even open them up. So it's a vicious cycle. So diabetes, kidney failure, vascular health, and this is increasing, I personally feel.
And what is one case that really moved you or it really stuck with you?
Oh, there was one case. We had this young boy who was flown in from Ladakh, I think 2008, 9, something like that. And we did a CPR, like he was dying actually in the emergency. And he was flown in a helicopter, and we rushed him into the theaters, operated. I was young, and we actually saved him. And then later on, when we investigated him, so that young boy had a congenital aneurysms in his body. Aneurysms means your blood vessels, they dilate because of genetic reasons. So instead of blocking, they dilate and then they rupture. And if your main blood artery rupture, imagine what will happen. You will die. You will lead to that.
Obviously.
Yeah. So he had approximately 14 to 15 dilatations in the whole body. And so we kept on operating him, like we saved him, sent him home, called him after 1 month. So every 2 months we used to call him and repair one aneurysm because there's so many in a body. And in between, because he ruptured from another one, and then he came again in a very bad state. We repaired that again. So actually, we operated him multiple times, more than 13 times, very major surgeries. And he survived all of them. And actually, we could keep him alive for 15 years. And, so later on, he was come to death in some other hospital. He went with a ruptured aneurysm, some other hospital. They couldn't save him. So he kept on developing the aneurysms in other body parts. So it was very, I cannot forget that case because
I'm sure 13 surgeries are unforgettable.
Very major surgeries, and for many years. And we used to see him free of cost, and he used to just come in, just walk into, he was like a family, just walk into our clinic, just like that.
So one of the reasons that we actually started this podcast was because there was so much information regarding health on the internet, and it's so confusing to know what to believe and what not to believe. How do people how should people stay away from misinformation on the
Very,
internet?
very good question. Very close to my heart. And I'll tell you something. 2 years back,
Mhm.
we had a very big symposium in Dubai, in UAE, with 250 physicians all across
Okay.
the world. And the heading of the meeting was fake news.
Oh wow.
And we published an article of like 40 pages. And anybody can Google my name and read that article. It's on fake news. You will be shocked with the numbers. And it's all legitimate data which has been collected by the agencies. So, more than 85% of the news regarding the health which is published on the internet is fake. It's like we took up all the social medias. We had 22 platforms across, and we took up the news which is published according to the health, according to the products. So it's all.
And these are legitimate
There is a
websites.
published data, like it's all Facebooks and
Oh.
Instagram. Like we took the data from there, and then we cross-checked the data. Like, let's say any compound. So, what is the amount of fake news which is there on the social media?
85%.
So you read this article. It's with my name, Fake News Project, and with more than 200 world physicians from different countries, more than 50 countries across. We publish this article, and it's like mind blowing. So if your project and if your podcast is on this, I'll send you that article. You
Yeah,
must read this article.
sure.
This will really help you in taking this podcast to a next level.
Thanks.
Because
We can do a podcast on the fake news.
absolutely, because really amazing. It is unbelievable.
So how do we save ourselves from this misinformation?
Very simple. I think common sense. Okay, so this is my thinking. One should stick to natural things.
Okay.
This is common sense. So anything which has been there in the world for more than 400, 500 years, people have been eating that. So most probably it will be safe. Most probably, I should say, because nobody knows. And anything which is packed on unnatural is definitely bad. It doesn't require common sense.
Right.
And so very simple. So I feel one should stick to the natural products, natural things.
And other than that, don't believe anything on the internet.
And most of the other things, one should not get into it. And like people, I'll give you an example. People eat lots of medicines to sleep. Is one of the $1 billion industry.
Right.
How do you sleep?
Melatonin.
A lot of. I don't want to get into that. Like
Right.
huge industry. Another industry is hair fall industry.
Oh, yes.
Huge. Third industry is like how to make yourself white. And
that's only in India.
No. It's all over the world.
Really?
Yeah, of course. And so how do you look fairer? And
but all of these are hoaxes, right? It can't
of
really
course,
happen, right?
So there are hardly anything which works. Okay, but it's an industry which is like anything. So now tomorrow, if you make any oil at home, and then you market it like anything, you spend a lot of money to make sure that you apply this oil and your hairs will not fall.
People will buy it.
People will buy it at least once.
That's true.
Twice. And then they'll say there is not much response and they'll stop doing it. But this is enough
money.
This is enough money. Imagine so many people buying that product and everything. There are some products which works. It's not like that. They're all bad. But how to identify which products works or which products, it's very difficult. It's very, very difficult. So that's why I feel that one should stick to, exercises, because if you exercise, most of the joint pains and everything will not happen. Your muscle strengthening exercises you do, most of those body issues will not happen. And if you get tired and if you're not stressed by like different things, you'll sleep well anyway.
Right.
And if you eat healthy, no smoke, no alcohol, and not non-veg, then most of the another very compound is an acid disease, reflux, burps, lot of but very big industry. So those things will not happen. And late eating habits. So people, if you eat at 8 and by the time 11 o'clock it digests. So if you eat at the right time, so most of the bad things which happens with the late food, but you take medicines, those will not happen. So most of the things actually can be corrected with yourself, with your own goods,
Right.
and you don't have to take medicines along with it. And there are some things which will happen with age, which you cannot control much, and which.
And talking about medicines, even if people have certain diseases and they're taking medicines, right? Like diabetes, you have to take
Yes.
medicine for the rest of your life. Do you think these medicines have a side effect on your body?
100%. You see, in one line, every medicines you take has side effects. Every medicine.
Even a paracetamol?
Paracetamol, if you list the listed complications, there are more than 200. So if you read the side effects of paracetamol, you cannot take it.
Mm-hmm.
You will say, I cannot take this paracetamol.
Yeah.
But
But
the
people take all these medicines.
chances of having a complication with paracetamol very rare.
Right.
So your question, does all medicine have side effects? Yes. Every medicine has side effects. But that does not mean one stops taking the medicines. So it's a risk and benefit ratio. So let's say you have diabetes, you asked me this question, and you're taking medicines. So your aim should be how I can have the best diet in the world
And the least medicine.
and a huge amount of exercise. So I have to have my doses of the diabetic medicine reduced to the minimum so that I can have the best blood sugar levels. So that should be the aim. So for combining everything, it's not about that you stop the medicines. That is not the right thing to do.
Yeah, of course. I mean, you'll have side effects from the medicine, but if you stop taking the medicine,
then the side effects of the disease are huge.
Exactly.
So that's why you need to balance it a bit.
Mm-hmm.
But you need to, and every disease is different, So, but all medicines, yes, will have some side effects. But sometimes you have to see that you take those side effects, the benefits are more. So that's why you have to balance everything. So it's a difficult situation. So that's why I always say again, come back, that prevention is better. So try not to have diabetes. And
prevention is always better than cure.
And that you can start from the childhood. So I think the basic thing what we have reached now in my life, what I have concluded in the last 25 years of learning, 30 years, is that the best thing to do is every family who has kids, they should start putting in the good habits in the kids. And that's the only way to change the next generation or the next country. And that will happen at home.
Yeah.
And so I think these podcasts will help that, people, all the parents. And you cannot have the parent drinking Coke and telling the kid, please don't have Coke, it's bad. So it cannot happen like that.
Obviously.
So you need to set up an example for the kid. So make sure that it does not happen.
So let's save the next generation at least.
Yes, that's the plan.
Perfect.
Okay.
Thank you so much.
Thank you. Thank you for the invitation.